Did you know that people with heart and circulatory problems are more likely to notice changes in their skin and nails than others? That's right. Many people think they aren't having heart problems, but sometimes it can be a silent issue. The National Institutes of Health reports that around 6.7 million Americans are currently living with heart failure. In this video, we'll talk about 10 signs on the skin and nails that indicate you may have a hidden heart problem or even issues with your circulation. If you notice these signs in you or someone you know, it's a good idea to let them know before any more serious issues arise. Stay until the end, as the last sign is the most common of all, and it's important not to overlook it, okay? Before we dive in, make sure to hit that like button, subscribe to the channel, and share this with your friends and family. Do you or anyone you know have any heart issues? What part of the world are you from? Leave your comment below. Here are the 10 skin and nail signs that may indicate heart problems. 1. Subungual hemorrhages. Stop everything you're doing now and examine your nails, both on your hands and feet. If you notice small dark lines or dots, red or brown, and don't remember injuring your nails, it's advisable to consult a doctor. These marks look like a splinter stuck under the nail. It's important to note that in most cases, these marks are the result of minor nail traumas. However, if these subungual hemorrhages come accompanied by symptoms such as irregular heartbeat, fever, or weakness, it may be indicative of a more serious problem. Bacterial endocarditis. This is a serious condition that affects the heart valves. Infective endocarditis requires immediate diagnosis and treatment. If not treated early, the mortality rate can reach 50%. The most common cause of endocarditis is the Streptococcus viridans bacteria, which normally inhabits the mouth. During certain dental procedures, such as dental implants, this bacteria can enter the bloodstream and adhere to heart valves. It's a serious condition, and subungual hemorrhages are just one of the cutaneous signs of endocarditis. Other skin signs may also be present in this condition. 2. Osler's nodes. Osler's nodes are another classic sign of bacterial endocarditis. It's important to be aware of this cutaneous manifestation, especially if other symptoms of endocarditis are present. Characteristics of Osler's nodes: small, painful bumps, red or purple in color, located mainly on the fingertips, but can also appear on other parts of the hands and feet. The size is usually 1 to 2 centimeters in diameter. If you notice the appearance of these nodes, especially if accompanied by other symptoms such as fever, fatigue, or signs of infection, it's crucial to seek medical attention immediately. 3. Janeway lesions. Janeway lesions are erythematous or hemorrhagic macular lesions, hard on the soles of the feet and palms of the hands, secondary to septic embolic events. While Osler's nodes are painful, Janeway lesions don't hurt. They are small, painless, hemorrhagic, and red spots that appear mainly on the palms of the hands and soles of the feet. They are not nodules, but rather flatter. They look like small bruises or contusions. So if you have fever, prostration, anemia, and have that hemorrhage under the nail, Osler's nodes, or even Janeway lesions, or all of them together, seek an emergency room for hospitalization because you need intravenous antibiotics. Janeway lesions are caused by the spread of bacteria in the blood, which can lodge in the extremities of the body, such as hands and feet. These lesions are more common in patients with infective endocarditis, an infection of the heart valves. 4. Psoriasis. You might be curious about the connection between psoriasis and heart problems, right? Recently, it has been found that there is a correlation. A 2015 study found a connection between psoriasis and a higher risk of heart arrhythmia, which is a condition that impacts how fast or slow your heart beats. Psoriasis is an autoimmune condition that causes inflammation in specific areas of the skin, like the elbows, hands, and scalp. Psoriasis can be pretty uncomfortable and itchy. It also leads to raised skin spots because the skin renews itself quickly. And like other autoimmune diseases, it triggers inflammation in your body, increasing your risk of atherosclerosis. Additionally, there's a connection between psoriasis and diabetes. Therefore, if you suffer from psoriasis, you should improve your diet, exercise, reduce stress, and see a cardiologist. 5. Livedo reticularis. If you notice that your skin has started to show reddish or purplish spots with a net-like or marble-like appearance, it could be a warning sign for heart problems. So some individuals notice this pattern on their skin when they get cold, but it goes away once they warm up. Sometimes certain medications can cause it too, and in those situations, there's usually nothing to worry about. But if you have a bunch of risk factors for heart issues, like being diabetic, having high blood pressure, or smoking, that net-like pattern called livedo reticularis might indicate some blockage in the arteries due to cholesterol issues. If this is your case, it's important to consult a doctor to find out if you have an undiagnosed disease. 6. Eruptive xanthomas. Eruptive xanthomas are the most frequent manifestation among the types of xanthomas. They are closely linked to elevated levels of triglycerides in the blood. They are characterized by the appearance of small, rounded lesions with a yellowish or orangish color, which appear predominantly on the thighs, legs, buttocks, and arms. The main cause of this problem is increased triglycerides, although it can also occur in people with diabetes. It's important to note that both elevated triglycerides and diabetes are risk factors for the development of atherosclerosis. Generally, these lesions tend to improve or even disappear when blood triglyceride levels normalize. Therefore, proper control of cholesterol, triglyceride, and blood glucose levels, in the case of diabetic patients, is fundamental for the treatment and possible remission of eruptive xanthomas. 7. Xanthelasma, yellow spots around the eyes. Xanthelasma is a condition that affects the eyelids and is characterized by the appearance of a small pouch of fat and cholesterol, which can also appear in the region of the eye bags and may indicate that your blood cholesterol levels are very high. High cholesterol can lead to the formation of plaques on the walls of arteries, blocking blood flow and increasing the risk of heart attack and stroke. The characteristic fat pouches of xanthelasma can grow if not removed with the help of a dermatologist. Almost half of patients with xanthelasma have abnormal blood cholesterol levels, and many also have diabetes and thyroid problems. 8. Cyanosis. Cyanosis is the bluish or grayish coloration of the skin, of the lips or fingertips, or even a limb, a leg for example, resulting from insufficient oxygenation of the blood. Cyanosis occurs when deoxygenated blood circulates through the skin, which is more bluish and less red. Cyanosis can result from various types of severe lung or heart diseases that reduce oxygen levels in the blood. It can also result from certain congenital malformations of the heart and blood vessels that allow blood to flow directly to the heart without passing through the air sacs, alveoli of the lung, where oxygen is extracted from the air. This abnormal blood flow is called a shunt. If you have cyanosis in one of your limbs, it's possible that that artery is obstructed. Normally, the limb will feel colder than the other side. 9. Nails curve downward. When nails curve downward and the ends of your fingers appear swollen, it may be a sign of clubbing, the medical term. This condition can indicate potential heart infections, heart disease, or lung issues. While many individuals may experience these signs without serious health concerns, it's a good idea to check in with a healthcare professional if you notice these changes in your fingers and nails, as they could be linked to conditions like lung disease or heart problems. 10. Edema, swelling in the feet, ankles, and legs. When we notice swelling in the legs, ankles, and feet, it's common to think about heart issues. Typically, this swelling occurs in both legs and may resemble freshly baked bread or cake. And if you press your finger into the swollen area, it leaves an indentation, which is known as pitting edema. This might indicate heart failure, a condition where the heart struggles to pump enough blood to the body. Over time, persistent swelling can result in thickened skin, discoloration, brown spots, and even ulcers. It's important to remember that swelling can also be caused by medications, kidney or liver problems, or chronic venous insufficiency, which occurs when the veins have difficulty moving blood upward in the legs. If you notice any of these signs in yourself or a family member, It's really important to consult a doctor for the right diagnosis. Now, we want to hear from you. Have you ever heard about these 10 skin and nail lesions that might indicate a heart problem? Share your experiences, questions, and tips in the comments. Let's build a community of knowledge about heart health. And if you found this video helpful, please type yes in the comments below. Also, don't forget to like, subscribe to the channel, and turn on notifications so you won't miss our next videos. Feel free to share this information with your friends and family so that everyone can be informed about these signs of heart problems. Before you go, check out these 2 videos we selected specially for you. I think you'll love them. Have an awesome day and keep healthy, my friends.